Hi everyone, I'm Jenny, a pharmacist from Kaisa Pharmacy, and today I'll be sharing to all of you about oral contraceptives. As we all know, there are many contraceptives available in the market for today. So today I'll be sharing specific about oral contraceptives as it's a preventive measure for getting pregnant in most sexually active female. So in the next slide, I'll be sharing to all of you about types of contraceptives that are available in the market. So next, I'll be talking about the type of birth control available in the market. So we have two types of birth control. Firstly is the combination pills, and then second we have the progestin only pills lah. So combination pills consist synthetic man-made forms of the hormone estrogen and progestin. So which means most pills in the cycle are active, which means they consist active hormones. But the remaining pill, which is the final week of the cycle, that normally falls under the category of being inactive lah, which means they don't contain any active hormones. So typically there are three types of combination pills, which means we have the firstly monophasic pill, the multiphasic pill, and also the extended cycle pill. So for the monophasic pill means as we can hear the term lah, we say mono because we have estrogen and progesterone in the same amount that is given throughout the cycle except for the final week of the course. So second, we have the multiphasic. Multiphasic meaning that we have different doses of progesterone and estrogen given throughout the whole cycle. The final week goes with inactive pills. Then the final type of the combination is the extended cycle pills, whereby there are 13, it's actually a 13-week cycle in which you take an active pill for almost 12 weeks. The final week you go for something that is inactive lah. As a result, you may only get your period about 3 to 4 times a year. So next, I'll be talking about progestin-only contraceptives. So progestin-only contraceptives are also known as the mini pill. So progestin-only contraceptives are taken for those who can't tolerate combination contraceptives. So in which the patient might experience breast tenderness, irregular spotting or bleeding, elevated blood pressure, also certain forms of headache. In such conditions, we may change it to progestin-only contraceptives. So people on progestin-only contraceptives may or may not have their period while taking this type of contraceptives. So this can be absolutely normal, but for further references, it's often advisable for you to consult a healthcare professional. So in the next part, I'll be sharing to all of you on how oral contraceptives work. Basically, there are two types of oral contraceptives, which is the combination pills and also the progestin-only pills. For the combination pills, they have two mechanisms in which one would prevent you from ovulating, meaning that it prevents the ovaries to release an egg, also known as the ovum. Second, these pills can also cause your body to thicken your cervical mucus. Hence, in such situations, it actually makes it a lot harder for the sperm to travel all the way from the cervix up to the uterus, hence preventing a pregnancy from happening. Second, we have the progestin-only contraceptives. As we all know, progestin is very much different from the combination pills. So basically, it helps by also thickening the cervical mucus. And however, it also thins the endometrium. So you might be wondering here, what is the endometrium? So endometrium is basically the lining of your uterus where the egg implants itself after being fertilized. So if this endometrium wall becomes thinner, it's harder for the egg to undergo to transplant or also implant itself to the endometrium, hence preventing a pregnancy from occurring. However, progestin-only pills may not prevent ovulation. So, how do you decide on how to pick on a new oral contraceptive to start on? Basically, there are few factors that you may have to look into when you're starting an oral contraceptives. So firstly, you have to look into factors that can affect your choice, such as your menstrual symptom, whether or not if you're breastfeeding, and your cardiovascular health, the risks of bleeding, and also chronic health conditions such as heart conditions, so also increased bleeding. And also we have to make sure that the oral contraceptives that you may start may not have any interactions with the medications that you are already on. So you may need to seek medical attention from a doctor or any healthcare professional to make sure that you opt or chose the right contraceptive that is suitable for your health condition. Basically, birth control does not protect you against sexually transmitted illnesses. To make sure that you're protected against STIs, you need to make sure that your partner uses a condom in addition to your daily pill. Also, you have to remember to take your pill every day at the same time. In case you forget, make sure you remember to take it within 8 hours from the time that you're actually supposed to take. In case you have missed a dose, you may need to double up your dose for the first or the second day, which may be during the first or the second week into the cycle. But if you keep missing or delaying your pills, you may need to start a new pack, and your risk of pregnancy increases. So that's all from us for today. I hope this video is beneficial to all of you out there. So for more information, please do not hesitate to walk into any of our Kaiser pharmacy outlets. Thank you.